We discussed the risks of GBS, both early and late onset. Now let's discuss the risks of antibiotics. Hello and welcome to the Midwife Says, where I share evidence-based facts about women's health, pregnancy, birth, and postpartum. My name is Melanie and I am almost a licensed midwife in the state of Florida. Today we're going to talk about quite a controversial topic that comes up in pregnancy, which is GBS, or group beta streptococcus. I really like to preface these more sensitive topics by reminding my viewers that my goal is never to persuade your choice in one way or another, but simply to provide all the most accurate information that I can find to help you make your own choice. With that being said, let's start off by defining GBS and how it's tested for. In pregnancy, every woman is routinely tested for GBS around 36 weeks. This test is performed by inserting a swab that looks like a long Q-tip about an inch into the vagina and doing a circular motion across the vaginal walls 3 to 5 times. The goal is to obtain as much bacteria from the vaginal walls as possible. The same swab is then inserted about half an inch into the rectum, and the same process is completed. This swab is then placed into a tube with jelly and is sent to the lab for testing. This test is very fast, it should never hurt, and in many practices, providers are beginning to give women the option of doing the swab herself in the bathroom, as research shows there is no significant difference in the accuracy of results, and it maintains privacy and autonomy. So what exactly is GBS? It is not an STD or STI. It is a normal bacteria found in the GI tract and in the vagina, and it only becomes a problem when the colonization of the bacteria gets too high. As of today, we are not sure what the exact cause of GBS is. We do know, however, that certain groups of people are more likely to be colonized by GBS. These groups are those with a healthcare occupation, higher income, greater educational attainment, and those with an elevated BMI. Some studies have attempted to link maternal age and gestational diabetes to GBS, but there is currently no strong evidence to support that any of these factors are related. Let's discuss the risks of GBS. For the mother, there are no risks. This bacteria is harmless in the vagina. If it gets into the urethra, it can cause a UTI. Our main concern is the health of the baby. While the likelihood of transmission of GBS to the baby is low, and this rate depends on various factors, including how long have the waters been broken, or are they broken at all, how long has the baby been in the birth canal for, etc. According to data from the CDC, the transmission rate is 1 to 2% in those who did not receive antibiotic treatment. GBS infection in the newborn can cause things like pneumonia, meningitis, and sepsis, depending on the severity. So, let's say the baby does contract GBS from the birth. That's that 1 or 2% chance we just talked about. This is also called early-onset GBS and can present anywhere from 24 hours to 6 days of life. So then what? In this case, GBS colonization typically presents with symptoms of respiratory distress such as prolonged absence of breathing lasting more than 20 seconds, rapid breathing of more than 60 breaths per minute, grunting respirations, bluing of the mouth, gums, or face. This is due to the swelling of the lung tissue from the GBS bacteria. In this case, the baby needs to be brought into the hospital for observation and treatment. Once in the hospital, the baby will receive antibiotic treatment through an IV and is typically in the hospital for a few days. If meningitis or sepsis is present, antibiotic treatment is typically more aggressive and babies are usually kept from 7 to 14 days. Before discharge, the baby will be examined by a pediatrician and blood work will be completed to ensure the baby is safe to go home. A healthy full-term infant who becomes infected with GBS has a 95% chance of survival if treated properly. Late-onset GBS is a bit different. This is not passed from birth. It has nothing to do with delivery. This type of GBS is contracted by caregivers or the environment. Late-onset GBS presents on days 7 to 89 of life and is more severe, with most cases presenting as meningitis or sepsis. A healthy full-term infant's chance of survival, if treated properly, is 92%. To prevent GBS, most countries currently follow the standard of IV antibiotics in labor, which is routinely ampicillin or other penicillins. A susceptibility test can be ran if you're allergic to penicillins to see what other antibiotics can be utilized. With the use of antibiotics, the rate of transmission to the newborn is decreased from 1 to 2% to 0.25%. In order for this rate to be decreased to this level, a loading dose, meaning an initial dose of 2 grams of ampicillin, must be administered 4 hours before delivery. It is important to note that this protocol does not protect babies with the same effectiveness whose amniotic fluid is infected. Studies are being done to understand the proper treatment for these cases. We've discussed the risks of GBS, both early and late onset. Now let's discuss the risks of antibiotics. While there is a significantly decreased risk of GBS transmission to the newborn, there are also risks to the newborn and to the mother if antibiotic treatment is used. One of the main concerns is antibiotic resistance. So the organism is no longer being able to be killed by an antibiotic. Other things like yeast growth on the newborn presenting as thrush or a yeast infection, and altering of the infant and mother's microbiome, which affects the immune system and the ability to combat exposure to future pathogens. Again, this information is not to persuade you in one way or another, and something that is very important to me on this channel is that I always include evidence-based information from every side. So that's why today I'm delivering you the risks and benefits of GBS. Well, there's really no benefits. The risks of GBS and the risks and benefits of antibiotics, because to make a truly informed decision, you need all of the information. And sometimes a routine course of care is given the benefits, but we don't talk about the risks. And even if that may be statistically the safest choice, it's still important to know what the risks are. So there we have it, a very brief overview of GBS. As I was making this video, I realized that this would probably be a series of videos because GBS is such a dense topic. So if you have any more questions about GBS or you're interested in a GBS series, please let me know in the comments below, and I would love to make that for you. Take care of yourselves, and I'll see you next time.